The webinar is going to be focused on the most up-to-date issues on hepatocellular carcinoma, but also the most controversial topics. We know today that we're facing an era of evolving strategies for hepatocellular carcinoma in terms of surgery, systemic therapies, epidemiology, and even classification systems. And in these regards, interventional radiologists need to be updated, but also they need to understand how to refine their treatments and how to reallocate their treatments in the different scenarios of hepatocellular carcinoma. So we will talk about guidelines, we will talk about classifications, we will talk about ablation, TACE, radioembolization, but obviously we will need to compare our results and our treatments to everything else that is now available on hepatocellular carcinoma and suggest how to insert new and old treatments in this scenario that is rapidly evolving. So this is a webinar that is intended to be very interactive. There are going to be lectures that are pre-recorded. However, there is going to be plenty of time to ask questions and to debate, not only between faculty members, but also between attendees and members of the faculty as well. In the first part of the afternoon, we will discuss about HCC classification and the standard, but also the borderline indications for ablation, TACE, radioembolization, and obviously we will discuss also about systemic therapies. And then in the second part of the session, we will have a lot more details on the clinical management of hepatocellular carcinoma in daily practice. We will discuss about the role of biopsy. We will discuss about the role of loco-regional therapies in view of transplantation. And finally, we will see how we should manage specific situations, bleeding tumors, tumors with macrovascular invasion, and tumors that arise in patients without cirrhosis. All these situations, indeed, have no algorithm yet, so it is difficult to decide how to treat these kind of patients. Ultimately, we cannot stop the webinar without talking about immunotherapy. This is an evolving field, a very exciting field, but it is also a challenge for interventional radiologists because we need to know when and how to propose our treatments in the new scenario of immunotherapy. So this webinar is intended obviously for interventional radiologists, both expert radiologists, but also radiologist beginners can participate to the webinar. But obviously, it should be nice also to have other types of physicians joining us. We know that for hepatocellular carcinoma, we need to have a multidisciplinary tumor board actively involved, so surgeons, hepatologists, oncologists, nuclear medicine physicians, they all are working together for treatment planning in hepatocellular carcinoma. And work together means to have all the same skills and the same level of knowledge in order to have an equal active contribution in decision process. Well, what I would really like to see in this webinar is a lot of interaction. It is true that the faculty members are all esteemed experts in this field, but it is also true that everyone can contribute with its own point of view and with experience and challenges. And probably from this contribution, we will all gain in knowledge, but also new ideas and horizons. So I really believe that the only way to be successful in this kind of webinars is to be as much interactive as we can and discuss a lot about what is going on and what is the future going to be like.